Welcome to the press briefing. Today we have Dr. Chong Chok Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. The two doctors will brief you on the Hospital Authority and the number of confirmed cases. First, Dr. Kwan. Good afternoon. We have 2,114 patients in the hospital. Of those, 201 are newly confirmed patients. For those in isolation facilities, 1,042 in total. Yesterday, 4 patients' cases reported to be critical, 4 in serious condition. Among the patients in hospital, there are in total 41 patients in critical condition and 34 in serious condition. 14 of the critical patients are receiving intensive care. As for the number of deceases, there are 7 new cases, 6 males and 1 female, aged between 72 to 93. Of the 4 deceased patients, 4 have not completed 3 doses of vaccine. In the past day, 307 patients recovered. 262 of those have been discharged. So that's all from me today. Thank you. Good afternoon. Yesterday, for the number of confirmed cases, 5,038 yesterday. 1,168 PCR positive cases, RAT positive cases, and 3,870 PCR positive cases, 150 imported cases. 4 of those 143 are PCR positive cases, 9 RAT positive cases. And among the 150 imported cases, 50 cases are found at the airport, and then 55 specimens are found at quarantine hotels and centers, and then 38 cases found at community testing centers. The 150 cases came from 33 places. 4 places imported more than 10 cases. UK 25 cases, Singapore 13 cases, USA 12 cases, 11 Singapore 11 cases, and then for the remaining 20 cases, they come from the remaining 29 places. They are responsible for importing the remaining cases. And then so far, as mentioned, there are 7 death cases yesterday. So in total, in the 5th wave, we have 9,893 death cases. There are 7 homes for the elderly and 1 home for the disabled that reported 14 confirmed cases among residents. 41 residents need to be quarantined. For schools, this is not a school day, but then we recommended 4 schools involving 5 classes that need to suspend classes for 1 week. In 1 school, there are 2 classes that need to be suspended for 1 week. As for the subvariant strain L452R, the proportion is now 86.9%. And if you multiply that by the number of cases in the community, then for BA.5 is 80.2%, and then BA.4 is 6.7%. BA2.1, 2.13.2%, BA2.2, 9.9%. That's all from me today. Thank you. So the floor is open for to questions. Please raise your hand and we'll hand you the microphone. Please first identify the organization you represent before you speak. In the middle, at the back there, the one in white. Good afternoon. I'm from TVB. First, starting from tomorrow, you will stop hosting the press briefing. Now, do you have any, sentiments to share with us? Under what circumstances would you be calling the press briefings again? For example, if there is so many number of confirmed cases, then you may again call these press briefings. And then for the 4th wave and 3rd wave, usually there is a small number of cases, and then you stop hosting the press conference. But then today we still have a few thousand cases. So is it your policy not to ensure zero COVID? And then if you just issue press releases, it's the same as having a press briefing, because then coming from you directly is not the same. As for the 0+3 measure, it will be implemented starting from next Monday. But then there are airliners there's one flight coming from Taipei to Hong Kong. It will land at 2 a.m. So for those passengers, would they be subject to 3+4 or 0+3 quarantine arrangement? And then Professor Ivan Hong said that if the number of the percentage of imported cases accounts for just 5% of the total number of cases, then there's the condition to relax the quarantine arrangement to 0+0. So what is your view on that? Thank you. Well, in the past 2 years, we would like to thank the understanding and the support of the public, and also for the cooperation with various infection control measures. I hope we will all, stay vigilant and keep, working hard on it, and hopefully very soon we'll be able to return to relatively normal activities. Now, you mentioned the case 26th of September, 6 a.m. Well, I cannot really give you the answer now. Perhaps after the briefing, I have to check with my colleagues first, because the press release says that it's starting from the 26th of September, but whether there is this time of 6 p.m. or I have to check that. I understand the government's measures are moving in the direction of minimizing inconvenience to the public while ensuring infection control. So we will be monitoring the situation closely, and where there's room for further relaxation, we'll certainly consider it. Next, the lady on the second last row. I'm from Now TV. First, about the number of imported cases. Is it 150 or 152 or 153? Can I clarify the figure? And also, in deciding whether there will be press briefing on the COVID, it depends on the number of local cases. So what is the criterion you go by in deciding whether you need to call press briefing? Now, if there are, say, major outbreak of clusters, large clusters or clusters involving hospital authority staff, would you then call a press briefing? Now, so for the time being, this is the last press briefing you're hosting. So do you have any advice for the public to remind them? And there is a relaxation of more and more measures. So how should the public look at the epidemic as a whole? And last question, in one school there are 2 classes that need to be suspended. So could you give us the name of that school and how many students are involved, and are the cases linked in any way? First, about the school, Yuen Long Government Secondary School, Old Students Association, Tang Siu Tong Secondary School, Class 3B and 5C. We don't see any link for the time being, but in each class there are 4 students infected, so that's why the 2 classes have to be suspended for a week. You asked under what circumstances the press briefing on the updates of COVID will be held. Well, of course, we all would like to see that as the epidemic stabilizes, so we are able to adjust our risk communication strategy, just as we adjust the quarantine measures for inbound travelers or social distancing measures. So we would like to issue press release in the place of press briefing, and then we'll be able to give you the number of confirmed cases each day, and also we'll be updating our website. That's all. Sorry, speaker is not using a microphone. Sorry, the speaker is not using a microphone. On imported cases, 152 cases, 59 found at the airports, 55 found in quarantine hotels and quarantine centers, 38 found in community testing centers. And I think we are, coming down from the peak, and the situation is stabilizing, and then the epidemic has been going on for some 2 years now. So the government would like the public to be able to go back to relatively normal day-to-day activities, and of course that's on the premise that the infection is under control. Now, in the past 2 years, I'm sure the public have learned a lot about infection control measures, wearing the mask, washing the hands, and so on. And these are all very useful means to prevent infection. But of course, that's not exhaustive, but these are the basic measures we can take. And we can see that in a community, we see a drop in the number of upper respiratory infection cases too, such as flu or involving children or other infectious diseases. We're seeing that with these measures, we're able to reduce transmission of these other infectious diseases as well. And then for those cases, confirmed cases, of course, you need to declare the cases, you need to go into isolation, and you need to comply with the government infection control measures. Thank you. Next. To the right, the one in blue.
I'm from cable TV. For the relaxation of social distancing measures, can we further relax them? And do you know when we can stop wearing masks? Also, some of the airline staff have to comply with some closed-loop measures, as well as other arrangements. Are there ways for them to, or is there room to relax these measures? I think government or health bureau are all monitoring the implementation of different measures. If there is room, we would definitely consider relaxing them. Next, the one at the very back. Good afternoon, I'm from Hong Kong 01. Yesterday, the death number was adjusted to 153. Are there ways to prevent such mistakes in the future? Also, there were experts saying that COVID will become an endemic. What do you make of it? Do you think the epidemic will end in Hong Kong soon? I think whether it will become an endemic, it really depends on the global situation. Hong Kong is part of the international world. Currently, we have several thousands of cases. I think there is a very slim chance of having zero infection at the moment, because it will have to wait until there will be no more cases around the world. From what we can see now, we will have to coexist with COVID for some time. 153 more death cases were announced yesterday. This was after the discussion with the relevant departments related to the COVID list. So we had to adjust the number, and after the adjustment, we saw that in the death cases we announced there should be 153 more. As you see, between February and April, it was a peak season for death cases. And there were relatively more confirmed and death cases during that period. And after adjusting or reviewing the statistics, we realized that some of the cases were not recorded in our system. And after checking with the COVID-19 list we have, we saw that there was a need to add more cases to the list. And after some patients passed away, we found the RAT positive record of these patients, but we had not verified their personal details yet, so we had to add these cases to our list. Also, in some of the cases, they had earlier dates of getting positive, but they may not be within the definition of reported cases. So they may have been eliminated from the list. So after we have compiled the data, in the future, we will update these figures onto the website. Thank you. The gentleman on the right. Good afternoon, I'm from RTHK. I would like to ask Dr. Chuan about the death cases. Should there be over 10,000 cases? But you mentioned 9,000 just now, so I would just like to clarify on the number. Regarding the number of confirmed cases, it's going down to about 5,000 now. How would you assess the COVID situation now? in terms of the current wave reaching a plateau with a few thousand cases every day. Since we will not be having a press briefing for a period of time, how would you describe the current stage of the epidemic situation? Is it coming to the final chapter of COVID? And how would you describe your work over the past period? And did you find it very difficult? Can you share your feelings with us? Thank you. I think it's hard to estimate the trend, but based on the previous experiences, we can see that it is going down. There could be a chance of having a rebound, but I believe it would not be a significant rebound. A lot of people have been vaccinated now, and a majority of them have been infected, so there is a certain level of immunity in the community. So even if there are still COVID positive cases, we hope that there won't be a high number of serious or death cases. In the fifth wave, there is 9,886 cases reported yesterday, and this is accumulated from 2019. And this is adding up the first wave, 213 cases, so in total more than 10,000. I think it's not appropriate for me to share my personal feelings here. Next question.
South China Morning Post. First question is to ask the CHP and whether they think now that the pandemic has sort of stabilized, is there any room to relax the social distancing measures? And the second question, earlier you mentioned that it would be hard for Hong Kong to go back to zero. Do you mean that in which by saying that it'd be hard to achieve the zero COVID situation that the government wants to achieve? And lastly, with the suspension of the daily 4:30 press conferences, I wanted to ask, is there a threshold into when the CHP will decide to hold these press conferences again, perhaps when cases break above 10,000? And on a separate note, as these press conferences will be suspended today, is there anything that the CHP or perhaps the HA would like to say to the wider public before these press conferences are suspended? Thank you.
I will answer first. I think the government and also the Bureau will be closely monitoring the situation in Hong Kong, and if there is any further, to closely monitor the situation, and if there is possible, it would announce new measures to relax. And I think that now we have gone through the fifth wave since early this year, and majority of the population have been infected and or fully vaccinated, but we still have quite significant number of cases in the community, and it is very infectious, and it will be very difficult to achieve zero cases in the community. So at present is our thinking, and we don't have a threshold of number of cases that we will revert at the press conference, but if there is any situation that on a case-by-case basis, we may hold press conference every now and then, just like before the COVID pandemic. Yeah.
So on the HA side, we are aware that there's the situation, the confirmed case has been decreasing, but still we urge the public, especially the elderly and the child, to stay alert and to seek medical help if they have any symptoms. And I also want to tell our citizens that we are still running our community facility. For example, for those designated clinics, the teleconsultations and also the drug delivery service, as well as the hotline. These services are still maintained because we want to ensure that our public will receive the appropriate care during this difficult time, and also to ensure that if they can have the medical consultation should their condition changes, so that this will help our healthcare system to decrease the pressures. Besides, we are working towards to resume our normal hospital activities. And for example, we have announced yesterday the general outpatient clinic has been reverted to some of the previous suspended services. And also we are working towards to resume some of the non-emergency service as well as the day service, and hope that we can at the same time take care of those patients who do not have the COVID, and that's what we want to tell our public.
I would like to ask the public to keep up the personal hygiene measures, such as washing hands, wearing masks, keep social distancing, and obey all the prevent and control measures. The prevailing prevention and control measures as advised by the government.
Next, please. Lady on the back. I'm from Ming Pao. On the breakdown of imported cases at community testing station, how many are from days 4 to 7, how many after day 7? And then for adjusting the death statistics, you say there's no information in the X-ray system. Can you elaborate a bit? Is it say a case of someone passing out on the street, and because the person did not carry ID card, so you couldn't check their identity, or what? And what about die off and die with cases? And could you review certain death cases? Maybe you would find that they're not related to COVID, so the number could be taken out of the 10,000 plus statistics. And you say there may be room for for relaxing further social distancing measures. Which measures would go first, and what condition must be met before you will assess whether certain measures could be relaxed? I did not say that we could relax social distancing measures. I would just say I did say that the government would be monitoring the situation closely, and where there is room, where it's possible, measures will be relaxed. On the number of imported cases, days 1 to 7 found at the community testing center 35 cases, and days 8 to 10, 16 cases. Now you mentioned that maybe a patient came to the emergency department, that person's passed away, or maybe the person had PCR or RAT test. Then we may not have the full information at the time. And then on death cases, whether it's die with or die off, well, we're still actually reviewing some of the cases. So it's not yet appropriate for us to draw any conclusion at this point. Thank you. Next. To the right at the far end, the lady at the back. I'm from Tai Kung Pao. Dr. Chuang. You've been, hosting press briefings for close to 2 years. So what are the most unforgettable moments for you? And would it be the last press briefing on COVID? Well, as I said, I don't think it's appropriate for me to share my personal feelings here, but of course I hope very much this will be the last press briefing here. I would like to take this opportunity to wish you all great happiness and good health. That's the end of the press briefing. Thank you.